Good evening. Am I audible and visible? Yeah, welcome everybody. Welcome to Prep Ladder's YouTube channel. This is Dr. Shanmugapriya, your Prep Ladder faculty for biochemistry. And I'm here today with a mind-boggling question, a question which is boggling everybody, and it's a time-sensitive question. Should NEET PG strategy be changed after INI-CET May 2026? Right? So to answer this question, let me right away answer this question even before we start the session, right? The answer is an yes and a no. Okay, yes, because INI-CET May 2026, as you saw, delivered clear signals, right? Because many students who came out of the examination hall were apprehensive. They said the question paper was moderate to difficult. They were saying that question was tricky in the sense many choices were tricky, and they were trying to they were finding it very difficult to choose one among the four choices. And case-based MCQs, they were like never ever seen topics based, right? For example, in surgery, colon cancer based MCQs, they'd never seen. And as always, ophthalmology question were unexpected. The topics that they chose in ophthalmology were unexpected topics. And biochemistry, as you know, there were so many questions in biochemistry this year. There were 16 MCQs. Many students even said there were very minimal number of PYQs, right? Previous year questions were minimal, is what I got to hear from many students who came out of the examination hall. Overall, students said the question paper was moderate to difficult. So this clearly gives you a signal that competitive medical exams are heading towards a different direction, a different dimension, which means the way you prepare should also change. So the honest answer to this question is a yes. But at the same time, I would also like to say no, you don't have to change a strategy, because the core principle based on which this question paper was set had not changed. Okay, because I also got to meet some students who said it was easy to moderate because I was diligently doing PYQs in the last few days. They, they said they were actively involved in active recall by writing grant tests. And they said they focused more on conceptually learning all 19 subjects. So the summary is, those who did diligently PYQs, those who wrote grant tests during the last few months, conceptually learned all 19 subjects, found the paper to be easy to moderate. So this session is not to panic you. Okay, the aim of the session is not to panic you, saying that you will have to change the strategy. Whatever you have done till now is not going to be of big use. I'm not here to panic you. Okay, this session is only to give you clarity and direction. Okay, having said that, before we get into the session, as I told you multiple times, those who wrote grant tests repeatedly got a good rank. Okay, which means you should start writing grant test, and that is why Prep Ladder. Right as we are discussing here, there is an important announcement that I would like to begin the session with. NEET PG mock test is live on Prep Ladder platform. Okay, right now. And so even during the session, you can open the Prep Ladder app and enroll yourself for this live test, mock live test. Majorly because this is going to be a grant test that is based exactly on the final question paper. You will find 5 sections, and the right combination of MCQs is what we have chosen for this examination. This will be an exact replica of what you can expect in the upcoming NEET PG exam. We have given enough thought into the way questions are framed, into the way we have added the right mix of MCQs, right mix of subjects, right mix of the type of MCQs that you might face. So this is not only going to give you an experience of what you're going to feel later on, but it also might give you a free access to Prep Ladder live sessions. So as you all know, on Prep Ladder app, Resolve Lab 2 sessions are happening, which is like a rapid revision session wherein all subjects will be taught to you in a very concise manner. For example, biochemistry will be completed in 2 days. and you might unlock free access to PrepLadder Resolve Lab 2 sessions. So that is like a gold mine for all of you. So please don't miss this. Enroll yourself for this. It is live on the PrepLadder app now. Okay, so having said that, so we have to follow these 2 steps: attempt the mock test, claim free live sessions. Now let's get on to the strategy. What can you expect in this session? In this session, I'll be discussing 4 things. The first thing is, what did we observe in the INI-CET May 2026 paper? What exactly did this paper make students feel? What were the differences that students faced during INI-CET May 2026 exam? That is part 1. Part 2, what has been the difference in subject-wise weightage when you compare INI-CET with NEET PG? As you all know, it's not the same. Subject-wise weightage that is given by INI-CET is different from the subject-wise weightage that is given in NEET PG. So I'm going to compare these two. I will be telling you what kind of subject-wise weightage you'll have to give as you're appearing for NEET PG exam. That is part 2. And part 3 is, what are the key takeaways based on INI-CET May 2026 paper? What are the key takeaways that NEET PG aspirants should have in their mind? And the 4th section is an overall strategy, right? An overall framework on schedule, and a schedule that you can follow for the upcoming NEET PG 2026 examination. So these are the 4 things that you can expect in this session. Let's start with, how was INI-CET May 2026? What were the exact changes that students faced? And number 1, let me start with my subject. Yeah, so biochemistry, as you could see, highest count in the INI-CET history. This time we saw 16 MCQs. I mean, actually, if you ask me, even in the last INI-CET paper, I was discussing 18 MCQs. But this 16 MCQs like core biochemistry. And if you look at the kind of MCQs that they had asked, out of the 16 MCQs, 15 MCQs we had discussed in rapid revision videos, LRR sessions. There was only one MCQ which we had never discussed. And as I always say, okay, if that one atypical MCQ, if you don't answer, your rank does not get affected. If you're not able to answer the 15 MCQs which are based on PYQs or PYTs, that is when your rank gets affected. But take it from me, if you ask me purely based on biochemistry, how was INI-CET May 2026? All my students said they were able to answer 15 MCQs. So I didn't find anything much different or difficult as far as biochemistry is concerned, okay, other than the one question that happened. And other than this difference, physiology, yes, there was a decline. There were only 7 MCQs this time. Okay, this is similar to November 2023. So initially there was an increase, now there is a decrease. I would say the contribution from physiology for INI-CET paper has always been volatile. It keeps increasing and decreasing. And as far as PSM is concerned, interestingly, I call it as interestingly, for you it would have been annoying, right? So there were number-based MCQs, so many number-based MCQs, and one of the MCQs even had decimal-wise precision. Okay, so all these point towards one fact. Okay, it's all about repetition. One time reading will not help you to recall all these numbers, wherein you are expected to have a precision as close to decimals. Okay, so it's all about repetition. Please take it from me. If you think your memory is bad, okay, if you think your memory is bad, your brain is evolved. Okay, one of the signs of evolution is bad memory, because I don't want to store a trivial information in my cortex. Okay, that is how brain has evolved. But as medical students, we should be able to overcome that limitation, and we can overcome that limitation just by repetition. So starting from today, your aim should be to repeat any fact that you learn multiple times. You should get involved in active recall, even if you think you've read it multiple times, right? Even if you're walking down to a restaurant to have a meal, on the way, you should get actively involved in the recall mechanism. What number did I learn today at 11 a.m.? Was it PSM related or biochemistry related? Is it like number of ATPs? How many number of ATPs did I get from aerobic glycolysis? How many do I get from anaerobic glycolysis? Every minute counts, right? So every minute counts. Every minute you're going to get involved in active recall. Only then such precision numbers can be remembered by any human being. Okay, and one other interesting difference that I saw in INI-CET May 2026 is many questions were based on reason assertion type, right? Even in biochemistry, there were two MCQs which are based on reason assertion type, which means they are expecting you to learn everything conceptually, right? Assertion is a fact. Reason is a concept. So they want you to know the fact, they want you to know the concept behind it, because only when you know why, you will be able to apply it. So this is what all educators in Prep Ladder have been telling you. Please switch over from factual mode of learning to conceptual mode of learning, in which case, irrespective of the difficulty level, right, whatever may be the question paper that you are facing, the question paper can be difficult, the question can be easy, that is not going to matter to you if you learn a subject conceptually. Okay, and then there were many image based questions. Yeah, I was told that 40 to 45 MCQs were image based, which means you should start learning images, start practicing images. Okay, so there are many IBQ. We did IBQ session on YouTube, Prep Ladder YouTube, for all 19 subjects, right? So before you go for your exam, please watch all those YouTube videos. All these are available for free online, right? So whenever you feel overwhelmed, as you're preparing for your NEET PG 2026 exam, that is going to be many a times when you feel overwhelmed to be actively involved in discussion or actively involved in revision. In that case, what you can passively do is watch one of those IBQ videos, where you can just keep watching those images. Those images get registered in your neocortex, so that on the day of exam, the moment you see the image, you're able to answer that MCQ. Okay, so these were the changes that we observed in INI-CET May 2026. Registered in your neocortex. What can we learn? Yeah, I'll discuss about this, Dr. Idiopathic. Okay, so this is about what we observed in INI-CET May 2026 subject-wise standouts. And one fact that is not in this slide that everybody knows is ophthalmology. Right, everybody who came out of the examination hall said ophthalmology questions were difficult. They were actually saying, even irrespective of whether a student had learned ophthalmology or did not learn ophthalmology, they would not have answered the question, right? So that is how difficult the question in ophthalmology was. And so this is about what happened subject wise, okay, in INI-CET. So what was clearly seen? Clearly seen is, as you can see here, biochemistry was 16 and physiology was just 7 MCQs. And physiology has always been like a volatile subject, and biochemistry, all MCQs were simple. Okay, but I also want you to understand that INI-CET signal is not exactly equal to NEET PG strategy, because NEET PG subject-wise strategy has always been different, right? So let's see what has happened in the last 5 years, right? Last 5 years, NEET PG subject-wise weightage has been almost constant, right? And we have always seen that medicine, surgery, OG, community medicine, right? These are the heavyweight holders, heavyweight lifters as far as all 19. When compared to all 19 subjects, these 4 subjects, they've never let you down. Medicine, surgery, OG, community medicine. And that has been followed by pathology, pharmacology, and biochemistry. Okay, this is an average. This is not my perception, right? This is not my perception. This is a factual derivation based on my analysis of the last 5-year NEET PG paper. Okay, so which means I would consider that these 8 subjects, right? So surgery, medicine, OG, community medicine, pathology, pharmacology, and biochemistry, I would call these as heavyweight subjects. Okay, 8. That doesn't mean the remaining 11 subjects are anything less. Okay, so this is based on the fact that for all these subjects, there had been more MCQs. Okay, now having understood this, what are the conclusions for NEET PG 2026? Okay, I would say you will have to upgrade your execution model. It is not just about the foundation, it is all about executing in an upgraded fashion. So what are you going to do? You're going to move from passive learning. What is passive learning? You just watching a video, right? Because you're all tuned to watching videos. You just watch video. Today I'm going to learn about ABG analysis. Let me watch a video on ABG analysis. That is just you passively listening to it. That is passive learning. That will not help you when you're trying to recall the answer on the day of exam. Now, this is the time when you're going to do that gear change. Move from passive learning to active recall. Okay. When I say active recall, that happens only when you write multiple tests. That is why writing grand test is essential. And that is why you're taking this mock test today. Okay. So that is point number 1. And point number 2, whenever we say PYQs, yeah, even this time students said 10 to 20% of MCQs were PYQ, not many. Okay, so it is not about PYQ, it's always about previous year topics. Okay, and when you learn previous year questions, how are we going to practice those MCQs? It is not like you read the stem of the question, you look at all these choices and then memorize the right answer. That is not how you're going to work out PYQs, right? So what you're going to do is read the question, choose the right answer, choose the probable right answer, read the explanation. Okay, after which, if it's a question that is based on recombinant DNA technology, read the entire topic, learn everything about recombinant DNA technology, learn about restriction endonucleases, learn about DNA ligases, learn about marker genes. So that is how you will have to work out PYQs. It's not PYQs, it is PYTs. Okay, and when you work it out, it has to be an active recall. You should find out the right answer. That is when you get to know what kind of mistakes you commit. Okay, that is about you. Number 2, that is when you understand what kind of distractors are given by questioners, right? So those who set up question papers are not from a different world, right? They're from the same world wherein we all live. Okay, so they also have a pattern in the way they ask questions. So you should know a pattern of distractor that is given. You should know involuntarily, okay, if I see 2 similar choices, one of those 2 choices is going to be right. Okay, so that comes purely by practice. So you start working on PYQs. When I say read PYQs, what students start doing is they read the question, they immediately look at the right answer, they memorize the right answer, they read the explanation, they go to the next question. That is not how you do it. You will have to solve. That is when it gets registered in your neocortex. Okay, so that is about working on PYQs. And then when it comes to images, okay, do not panic when you see an image. For example, if you see a question on a graph, okay, I would say you should be very happy because reading a graph is easy. If you look at the x-axis, find out what is on the x-axis, check what is along the y-axis, okay, and then apply a simple logic. It is all about what happens when there are changes in the x-axis to what is on the y-axis. So everything comes by practice, okay? So passively look at images. Keep looking at images. Always try answering those MCQs which are image-based, okay? So, and then learn it conceptually. So image training is essential and that is going to start today. Okay, because in every question paper, at least 10 MCQs are image based. So why miss those 10 marks? Okay, so try working out image based questions from today. And then as I told you, because there are so many assertion reason based questions, always try to know why. This I say to every student of mine. Okay, please take a resolution today to always ask why to any fact that you come across, to any concept that you're taught about. Okay, always ask why, keep thinking about it, seek, find the right answer, so that on the day of exam, the moment you see the question, you know this is the reason that I learned. It can be a reason assertion type of MCQ, it can be a case-based MCQ. Once the concept is strong in your mind, okay, the type of MCQ does not matter. The level of difficulty does not matter. So please take a resolution today that from today going forward, you will ask yourself why, seek the reason and learn the reason. Okay. And all 19 subjects are equally important. Okay. Maybe the proportion of the time you spend for all these 19 subjects will be different, but that does not mean you're not going to learn one particular subject. Okay, your aim today should be to finish all 19 subjects. When I say finish, nobody on this earth can finish all 19 subjects, right? So when I say finish, you should have touched all 19 subjects before you enter the exam. So keep all 19 subjects alive. And I'm going to tell you how can you keep all these 19 subjects alive in a short while. But now, please remember, at any point in time, you should not say, I learned biochemistry 3 months back, so now I don't remember much of biochemistry, right? That should not be the case. You should keep all 19 subjects in your brain alive. I'll tell you how to do that, okay? Now, what is the 95-day? Can you please share some of your active recall which have been useful? First time attempt for PG, what is a strike rate of module questions? Because almost in all platforms, module questions aren't in the videos. Very happy minimalist. I'm happy that you followed my schedule and you got 191. Keep it up. Hi, Priyanka. Yes. Some of the techniques for active recall, right? It is nothing great. Active recall comes by writing tests. Okay. As many tests as possible, you will have to write from today. And that is what we are going to discuss here. There is no other better way of actively recalling other than writing a test. Okay. So starting from today, you have 95-day preparation duration. And how can we spend these 95 days? Okay, so these 95 days I've split into 3 phases. In the first phase, it is day 1 to day 40, phase 2 day 41 to day 80, and phase 3 is day 81 to day 95. Okay, and throughout all these 3 phases, there is something which has to remain constant, and that is you writing a grand test. In what frequency are you going to write a grand test? One grand test every 10 days, right? Because you're almost towards the examination, you have only 90 days more. So one grand test every 10 days. Today you're writing one grand test, right? So prep ladder mock test, you're writing one grand test. So from here on the 11th day, you're writing the next grand test. So totally you'll be finishing, apart from the test that you're writing today, you will be finishing 9 grand tests. Okay. And at what time of the day, at what period of the day are you going to write this grand test? Can you see this here? I'm asking you to have a protected block, yeah, daily protected block for writing grand test, which is going to be between 2 and 5:30 p.m. 3.5 hours. So why did I choose this period between 2 and 5:30 p.m.? That is the time which is least productive for any person, right? It's a postprandial period where you feel sleepy. But if you choose that time for writing a grand test, the adrenaline drive that you're subjected to is going to keep you alert and awake. And you're going to make even the least productive part of the day the most productive. Okay, that happens only when you get that adrenaline drive, right? So when will you get that adrenaline drive? Because I've seen some students saying, I wrote a grand test yesterday. And if I ask them, how long did you take to finish the test? They would say, I finished in 1 hour, because many questions I didn't know. Those topics which I didn't know, I just skipped. I only attempted the MCQs which are based on the topics that I've already learned. That is not how to write a grand test. Okay, if you're writing grand test, every grand test should be treated as if this is the final examination that you're writing. You're going to effectively utilize the entire 3.5 hours. All 200 MCQs should be attempted. And those 200 MCQs should be attempted even if you don't know anything about the topic. You're not going to skip it, okay? Because we have written all these 19 subjects as tests and as exams during our undergraduation days. Even if you underestimate the type of learning that you did during your undergraduation days, at least in the corner of your neocortex, there will be some information related to that topic. Using that information, you're going to make an intelligent guess and you're attempting every question. Do you understand this? Now, what are the advantages of you doing it that way? The major advantage is you get to know time management, right? So once you write 9 grant tests this way, on the day of exam, involuntarily your brain will tell you, usually by this time you would have finished 30 MCQs. Today I have not finished 30 MCQs, which means you have to buck up, right? Or it would tell you by this time, usually you would have finished 30 MCQs. Today I've finished 40 MCQs. So please take some time, go back to the question that you marked for review, spend some time, try to answer it. So all this should happen in an involuntary manner. Okay, you cannot get to know time management by watching somebody who's on YouTube telling you first 10 MCQs should be finished in first 10 minutes. Okay, so that is not how it works. Your brain works in a unique manner. So you should know how your brain works. Based on that, your time management should be personalized. Okay, so that happens greatly if you write every grant test sincerely. That is point number 1. Point number 2, when you really attempt an MCQ and then when you go back and check the right answer, you get to know what kind of mistakes you commit, right? Many a times, in my case, I always skip the except part. I always skip the except part, though I know that concept, I know that fact, I make mistakes in that angle. So I got to know only by writing grant test. Do you get it? So you know the kind of mistakes that you commit only when you sincerely attempt an MCQ. Otherwise, you would tell yourself, I was not sincere about this question. Had I been sincere about it, I would have gotten it right. Okay, so don't give yourself that excuse. And then the third advantage is, as I told you, the kind of MCQ framing, right? You involuntarily or you passively get to learn the way question paper setters set up that question. Okay, so this is the kind of distractor that they usually give. This is the kind of distractor that distracts me effectively. On the day of exam, I should not get distracted. So all this gets imbibed, right? All these get imbibed in your brain only when you write grant test religiously. Okay, so this is about how to write a grant test. And what do you do after you write a grant test? Day 1, you're writing a grant test. Day 11, you're writing the next grant test. What do you do in the 10 days between? In the 10 days in between, what we are going to do is we are going to take those 200 MCQs divided by 10, which means 20 MCQs a day between 2 p.m. and 5:30 p.m. because we have blocked. We have blocked this only for grant test related activities. Between 2 and 5:30 p.m., I'm going to solve those 20 MCQs as 20 topics. Okay, please don't waste your time segregating MCQs as anatomy on day 1, physiology on day 2. Don't waste your time. Question number 1 till question number 10. Today, the mock test that is happening, question number 1 till question number 20, you're working out tomorrow. Okay, it can involve any subject. So 20 topics across 19 subjects you're revising, which means you're keeping all 19 subjects alive in your brain. Do you understand this? Otherwise, what would happen? In the remaining time, I'm going to ask you to revise subject wise. So suppose you're going to start with medicine tomorrow. Okay, on the 40th day, you would have forgotten medicine if you don't have a way of revising it. How are we going to revise all 19 subjects throughout? Yeah, by reviewing the grant test paper. Do you get it? This is how you're going to keep all 19 subjects alive. And one more fact that you should remember is when you review this paper, by working out these 20 MCQs as topics, you're going to note it down in your 20th notebook. Do you get it? So what is this 20th notebook for? This 20th notebook is for you to write down all important facts and important concepts, all volatile facts and volatile concepts in that notebook. Okay, so that is what we are going to do in phase 3. Right? Phase 3, the final sprint, right? The final sprint between 81st day and 95th day is only for you to review the 20th notebook. And that is when you're going to revise all 19 subjects quickly. Okay, so what do we do in phase 1 and phase 2? Day 1 to day 14, the remaining time between 2 and 5:30, you're going to write a grant test, you're going to review grant test. What about the remaining time that you have? In the remaining time that you have, the first 40 days, the heavyweight subjects, I told you 8 subjects, right? So those heavyweight subjects should be finished. How are we going to finish? You can watch rapid revision videos and work out MCQs. Okay, it is going to be not that difficult. Rapid revision videos for every subject, you can finish quickly by watching it because already you would have read it. And please don't get demotivated if you have not read all 19 subjects till now. Okay, that is, I mean, it is never too late. Do you understand this? It's never too late. 90 days is not something less. Yeah, miracle can happen in 90 days. Provided you put your heart into it, you put your mind into it. From today, it is going to be a smart work. It is not just about hard work. If you're going to take your book or if you're going to watch regular videos of all 19 subjects, you're not going to finish it. Okay, but you should know what to watch. So either LRR videos can be watched or rapid revision videos can be watched, and then you're going to write grant tests. You reinforce the same subject in multiple ways. You actively recall everything multiple times, and that is enough. Do you get it? So for the first 40 days, the 8 subjects we are going to finish. The schedule is up to you because you know which subject you have not prepared well so far. Okay, so you don't have to stick to those 8 subjects that I told you. The first 40 days is for those subjects which you're not very strong about. Okay, so spend enough time. Make yourself strong about all those subjects which you don't have a strong foundation on by watching relevant videos. You choose the video, you watch it, but your aim should be to complete all topics in those subjects. You can do it because we have so many resources, right? LRR video, if you want to watch biochemistry, LRR, it's going to be 4-5 hours, right? In which I would have covered the entire biochemistry. And that would cover almost 90% of, I cannot say 90%, at least you will have a strong foundation of the entire subject, okay? So instead of saying, I have not touched the subject at all, you have a foundation of the subject. That should be a aim, okay? So that is about phase 1. And in the phase 2, remaining subjects. Had you finished the first 8 subjects, the remaining 11 subjects should be covered in the remaining 40 days. So one time you should have read all 19 subjects one way or the other. You should never say, I did not touch anesthesia. I did not touch radiology. Please remember, radiology significance keeps increasing. In all competitive exams, the number of MCQs on radiology is increasing tremendously. Okay, so there was a time when we used to say radiology is a small subject, right? Anesthesia is a small subject. Dermatology, this time in INI-CET, there was many questions on dermatology. So don't underestimate any subject. You should know something about all 19 subjects. Okay. And in the last phase, wherein I told you, you have this 20th notebook. As you do all these 19 subjects, yesterday you gave your GT, your score was 133 and correct 62, negative 470 out of 800. Please tell me how negative marks decrease. So grant test is not to assess, grant test is to improve your performance. And this is really a good mark, good score that you have got, which is 470 out of 800, right? Because starting from today, when you write 9 grant tests before your exam, and by reviewing all 200 MCQs in between, his question, his or her, Prakash. So his question is, how do I reduce the number of negative marks? Okay, number of negative marks will reduce if you review all those 200 MCQs. Okay, you should have a foundation. You should have an understanding of all those topics. Okay, but otherwise, please don't be scared about negative marks. And I've seen many students saying, I was not very sure about this question, so I skipped it. Okay, historically, those who have attempted many questions have been great rank scorers. Okay, so aim should be it grant test or the final exam. Okay, if it's grant test, without a doubt, attempt all 200 MCQs. It can become negative. Please don't worry about it. Okay, but attempt all 200 MCQs. That is when you know where you commit a mistake. And on the day of exam, only when you're not able to even exclude one choice, if you're not able to find out in any form of intelligent guess, you're not able to find out the right answer, then you can skip it. Otherwise, I would say your aim should be to attempt at least 190 MCQs in the final examination. Okay, the probability that you score more when you attempt more number of MCQs is higher than the probability that you get negative marks. Okay, so that is a simple logic. So write as much as possible, attempt as many MCQs as possible. Don't worry about negative marking. Definitely not at this stage when you're writing your grant test. Okay. Medico, ma'am, how to increase grant test score? That's what I'm telling you. Once you revise all 200 MCQs before the next exam, your score will definitely improve. Yeah, do it. Come back and ask me if it has not improved. Okay, so if you review all 200 MCQs as 200 topics, my assurance to you is in the next paper, your rank or your mark will be better. Okay. Medico by choice, that's what I'm telling you. Try this. Okay. So this is about preparation framework, and I've given you a rough idea about what are the question papers that you should write as grant test. Today you're writing prep ladder mock test, and then the 11th day you're starting with NEET PG 2023 question paper. And then the next 10 days NEET PG 2024 morning session, then NEET PG 2024 evening session, and then NEET PG 2025. So thus that would include the last 4-year or 3-year papers. Okay. And then apart from this, INI-CET papers should be attempted. Okay, INI-CET papers and then FMG. So do not underestimate FMG paper. Okay, FMG papers are also standard. I've seen many MCQs which are more complex in FMG than what I've seen in INI-CET that can stimulate you to think. Okay, so like a miracle on the day of exam, you cannot expect your brain to start thinking. You should start stimulating it well ahead. Do you get it? And everything comes purely by practice, and that is why writing grant test becomes essential. And when you write many NEET PG papers, you understand passively, you understand what are the topics based on which questions are asked in all 19 subjects. Okay, so this is my suggestion to all of you. But any platform which announces mock test, please try it, because they put in enough efforts in giving the right kind of MCQ, right mix of MCQs. So apart from this, I would say apart from this, any mock test that is being conducted on platforms, please attempt. Okay, so this is about the 9 grant test schedule. And to summarize and tell you what kind of modifications should you do after INI-CET May 2026, I would say not much of modification. Okay, not many modifications are recommended by me. And in INI-CET, what I observed is there were actually many one-liners. Okay, there were many one-liners. So it is not like there had always been a trend. Okay, there had always been a zigzag change in proportion of MCQs as far as one-liners, conceptual MCQs, case-based MCQs. No question, no competitive exam has followed a clear trend, be it in terms of type of MCQs or in terms of subject allotment. Okay, and that is why I say give equal importance to all 19 subjects. But as far as NEET PG is concerned, give importance to medicine, surgery, OG, community medicine. Okay, and of course pathology. And the latest INI-CET May 2026 had some exclusive topics in surgery. As I told you, in colon cancer there were many MCQs, so please go look at it, because now it has become a previous year topic. And if you're not able to answer an MCQ based on that previous year topic, your rank will be affected. Okay, similarly, cancer based MCQs, now it has become a previous year topic, so please go ahead and read about it. Okay, and these are the basic changes that you might have to introduce in your preparation, but otherwise it is all about a strategic preparation that you will have to do. Okay, and what kind of people have always been winners in NEET PG? Right, so I've seen those students who revise all 19 subjects till the end. So it is not about what you have done in the whole 1 year. It is more about what you're going to do in the last lap of preparation that matters. So in the last lap, right? You should focus on all 19 subjects. And as I said, you should know something about all 19 subjects. You should keep revising all 19 subjects till the moment you enter into the examination hall. Okay, these are the kind of students who always get great ranks. And apart from that, those who write religiously the 20th notebook. So what should be there in the 20th notebook? All volatile facts, all volatile concepts. Okay, assertion, reasoning type. Many a times when you read a fact and you understand the concept, you think you have understood it. But then on the day of exam, suddenly, it becomes volatile. So write down the concept, write down the reason behind every fact. Okay. So when you write it, it gets reinforced in your neocortex. And then the day before exam, you're going to revise it. So that on the day of exam, when you see the question, it quickly pops up and you're able to answer it. Okay. So the 20th notebook, maintaining a 20th notebook is crucial. Write down differences between carbamyl phosphate synthetase 1, carbamyl phosphate synthetase 2. What are the differences? Hexokinase, glucokinase, what are the differences? Inhibitors of enzymes of glycolysis, inhibitors of enzymes of citric acid cycle, number of ATPs. So all these facts should be in the 20th notebook, because the day before exam, you cannot be going and taking a book or watching a video to revise all these facts. It should be your notebook using which you are revising. Okay. And please write 9 grand tests. You will come back and thank me. Okay. So do this religiously, rain or shine. Every 11th day, write this grand test. Every 10 days in between, right? In the 10 days in between 2 and 5:30 p.m., review those 20 MCQs as 20 topics. You'll definitely come back and thank me, because you've got good rank and good mark. Okay. And then learn images passively as much as possible. Watch as many numbers of images, okay, so that you are able to quickly answer on the day of exam. And PSM, yes, Dr. Neha might not agree with me. There are many facts that are always asked in PSM, but of course, only when you know concepts, you'll be able to answer many MCQs. So PSM numerical memory is also essential. Okay, so to conclude, exams are won by students who can recall, right? Who can recall the right fact at the right time, even at the peak of stress, right? Even at the peak of stress, you should be able to recall the right fact at the right time. Okay. And for that to happen, you should have done enough pre-work. And this is the pre-work time. You have enough time, 90 days in between. So plan effectively, implement effectively, and come out with flying colors. Okay. So to conclude, yeah, as I end the session, go back and enroll yourself for the mock test that is live on PrepLadder app. You have a great reward, wherein you will be able to unlock free PrepLadder Resolve sessions, which is Lab 2, which is rapid revision session. You will be completing all subjects in 2 days or 3 days each. Okay, so this will be an effective way of utilizing your time. So the video description today will include a link for you to enroll yourself for this live test. Okay, my best wishes. See you soon.